Coronavirus cases, as you know, have been spiking all over Arizona, especially in the southern part of our state.
Two of our border counties becoming hotspots for the virus, exploding in numbers. Our Allison Rodriguez went south to find out why these cases are rising sharply and what's being done to slow the spread and keep everyone safe.
Here's part one of ABC 15's new series looking at coronavirus at the border.
Arizona has been thrust into the national spotlight. There has been an explosion of coronavirus cases over the last month, and southern counties Yuma and Santa Cruz along the border are seeing some of the worst spikes.
I don't know that any of us really expected this surge, after the reopening of businesses and relaxing things a bit. I think things have just surged much more rapidly than what we had hoped would occur. And that's alarming. That's really is.
David Rogers heads up Sunset Health Community Center in Yuma County, a federally qualified health center, or FQHC, and he says they're busier than ever.
The phone just rings nonstop. Patients are trying to access testing. Patients are sick. They need to see a provider. Patients need some direction on, what it is they're supposed to do. It just really is overwhelming.
At the end of March, Yuma County was reporting 12 cases of coronavirus. Then in April, it was 6 times that. Now, an explosion. By the end of May, there were more than 1,000 cases, and 3 weeks later, there are more than 4,000. That's a 300% increase in less than a month. For comparison, Maricopa County saw a 42% spike in that same time frame. And it's a similar scenario down in Santa Cruz County, where cases have jumped 328% from the end of May to June 21st.
We started probably about a month and a half ago. We were steady at about 45, 50 cases, and then all of a sudden we started seeing an increase of anywhere from 30 to 50 to 60 cases a day. So that's when we started really heavily looking at the cause or causes at that point.
As of Sunday, Santa Cruz County made up 25.6% of all positive tests in Arizona, the most by far. Especially alarming given that it's one of the smallest counties in the state by size and population.
Well, I'm frustrated because of what I see and what I hear from my constituents. That neighbors are going out, people having parties.
Nogales Mayor Arturo Garino has been increasingly upset by what he says are lack of resources, including tests, and also residents not taking the safety messages seriously.
I've been messaging to the people of Nogales and Santa Cruz County in all the Mexican TVs, radios, newspapers from Nogales, Sonora, Hermosillo, papers from here. Look, I'm with you right now. I've been in Facebook, I've been everything, and I still get people in my constituents saying, "You're not putting the message out there, Mayor." Yes, I am.
As of Sunday, Yuma County accounted for 14% of positive tests across Arizona. This means almost 40% of all Arizona's positive tests are coming from these two border communities. Over the last 10 years, more and more businesses have opened up here along Main Street in Yuma. And as more people get out now, we've noticed about half of them wearing masks, the other half not. That number dropped significantly as we made our way through Nogales in Santa Cruz County. And health experts say the number of cases tend to rise sharply after large gatherings.
One thing we do know that it's been spiking after certain events. It spiked a little for the Easter week. It spiked after Mother's Day, and then then we're expecting the Memorial Day spike, and then we're having a bunch of graduations. The kids graduated and they had their parties.
Both counties are predominantly Latinx, and studies have shown that minority communities are testing positive at a much higher rate. As of Sunday, 26% of all cases were in the Hispanic or Latinx community, 17% white or non-Hispanic, 10% Native American, and 3% African American. Something that sadly doesn't surprise Dr. Edmund Baker, medical director of Equality Health in Phoenix.
When COVID was first identified in China, they said, people that are older, people with these chronic diseases such as liver disease, lung disease, diabetes, are really having worse outcomes. that's when I knew right away that the people here in this country that are going to have worse outcomes would be the ones that have chronic diseases just like that. Chronic illnesses such as diabetes, hypertension, lung disease, all are items which plague underserved communities.
In Yuma County, 63% of the population is Latinx, and they account for 72% of cases as of this past weekend. In Santa Cruz County, 83% of people are Latinx, and they make up 41% of the cases. But we may not know the full extent of how hard these communities are getting hit because the data collected has many gaps. There is a huge hole where race ethnicity data is just unknown, not only in these counties but also across the state. And that's why testing has become so important to health experts in order to really address where the spread is worse and how to mitigate it.
We also have to improve testing. So there has to be a lot of testing, free testing, for all these underserved communities, and we have to do it now. We can't wait.
He says because that's one way the whole state can work together to slow the spread.
We have to remember the state is open. The highways are open. So you may live in an area that doesn't have the same numbers as we do in Phoenix, or not heavily hit like some of the counties like Navajo, Apache, Yuma. But the problem is, people travel between these counties freely.
What's happening in these communities is clear now looking at the data, but the why may hold the key to helping slow the spread and get people help. The location of these counties, the top industries, and the access to more care. And that's what we'll explore in our next story on COVID on the border tomorrow. Reporting for ABC 15 Arizona, I'm Allison Rodriguez.